the title of my talk is Community Engaged Research in Pursuit of Equity, really thinking about from a breast cancer disparities perspective. Next slide, Brian. So I've been doing this work for many years, and in around 2014, a group of us came together around a seminal publication that demonstrated that breast cancer disparities between Black and white women were increasing, not decreasing. And they looked at the 50 most populous cities across the country, and Boston was number 5. This is in 2014 in a city with the best academic medical centers in the country, thinking and working collaboratively around breast cancer disparities. How could this possibly be? It was really at that time we came together across campuses from all of our colleagues from across different institutions and formed what's now known as the Boston Breast Cancer Equity Coalition to think how we might bring together all of these diverse voices to develop a citywide approach to reducing breast cancer disparities. We were fortunate to be funded from NCATS, the National Center to Advance Translational Science, for an innovative disparities award in collaboration with BU, Tufts, Harvard, and the UMass CTSA programs. And so you could see the multiple PI leadership team that's carrying out this program in strong collaboration with our community partners, which includes the Equity Coalition, a network of patient navigators in Boston, and a clinical advisory panel of medical, surgical, and radiation oncologists across the city. And we're also collaborating with our colleagues in Chicago, who happen to be the #1 worst city with Black-white disparities. So they have a vested interest in working with us. Next slide. Together, we design a pragmatic clinical trial to try to understand how might we systematically implement evidence-based models, and in this case, patient navigation as a care delivery model across the city to improve care for the most vulnerable breast cancer patients. So you can see from the list of participating sites, it's not often that the Brigham, Dana-Farber, Beth Israel, Boston Medical Center, MGH, and Tufts come together to care for a population of patients. But that's really what this study is all about. It's a pragmatic trial, and it's an implementation study taking evidence-based care and looking to see if we could improve care across the city. Next slide. This is a snapshot of our current enrollment. We're now in year 4 of what will be a 6-year study. We've enrolled we just passed our 300 mark of eligible participants who've enrolled in the study. You can see we have a very diverse racially ethnic population. Over half are non-English speaking, and 3/4 are on some type of public health insurance. Most are from the Boston area, but we include the greater Boston area if they're women who are eligible based on their sociodemographics. One of the major components of the patient navigation is to identify and understand social needs. And so you can see in our screening, more than half of these women who are diagnosed with breast cancer have some type of social need that is acting as a barrier to their accessing care. At another time, I'd be happy to talk with you about some of the challenges and facilitators of doing this work, but I'll end with this final slide just to get you thinking as you hear the next set of panelists speak. When we approach our research, the next slide shows us the sort of continuum of community engagement in designing and carrying out health services research. And I want to encourage you to think about where would you like to be on the spectrum of community engagement in the work that you're doing, and where are you currently? And how might we work collectively to get us to a place where we're far to the left of this next slide. Brian, I don't see us advancing. Is it just me? There we go. So this is the continuum of community engaged research. And to the far left is not really engaging the community very much at all. And to the far right is true CBPR, community-based participatory research that is co-led with the community. I would say for our study, despite our best efforts, we're probably somewhere between involve and collaborate. And so I would challenge you to think about where you are with your respective programs and how we might collectively get to the far right, because that's where the evidence suggests that health equity is achieved.